Hello, ladies and gentlemen. So we have some really crazy news, and this is coming from CNN. Let's see. Let's see. I have too many windows open. So I have to go and close windows because there's too many windows open. So let's see where this is coming from out of. Yeah, CNN. Vampire facial at New Mexico spa tied to two HIV cases, health officials say. This is by Jacqueline Howard out of CNN. And there's a video that accompanies it, but I'm going to read it because basically the video is going to reiterate what I'm saying. So, health officials are investigating two cases of human immunodeficiency virus, or HIV, is what it is called, among clients who received an injection related procedure, including vampire facials, is what they call them, at an Albuquerque spa. So the New Mexico Department of Health announced on Monday that the laboratory test indicated that two of the clients were infected with the same virus, increasing the likelihood that the infections may have resulted from a procedure at the spa. So now the health department is offering free and confidential HIV testing for hepatitis B and hepatitis C also, and for clients who have received injection related procedures at this VIP spa in Albuquerque, New Mexico, between May and September of 2018. So you can see it pictured here. It's called the vampire facial, and it may have exposed spa clients to HIV in New Mexico, health officials say. And so while over 100 VIP spa clients have already been tested, NMDOH is reaching out to ensure that testing and counseling services are available for individuals who have received this particular injection related services at the VIP spa. So if you've been to that spa and you had this facial, you might want to get tested. So Kathy Kunkel, New Mexico Department of Health's cabinet secretary, said in a written statement on Monday that testing is important for everyone there, as there are effective treatments for HIV and many hepatitis infections, she said. So free testing services are being provided at South Valley Health Commons and Casa de Salud Family Medical Office, both in Albuquerque, according to the department. So VIP Spa closed in September last year after an inspection by the New Mexico Department of Health and the New Mexico Regulation and Licensing Department. Barbers and Cosmetologists Board found unsafe practices that could have spread bloodborne infections such as HIV to clients, and also they're looking for other things like hepatitis B and C. So at the time last year, a representative of the spa declined to comment on with CNN, who attempted to contact a lawyer for the spa. So the vampire facial is also known as a plasma-rich protein facial. It involves injecting nutrient-rich plasmas into the skin on the face using a tool called a microneedling pen. So the plasma typically comes from your own blood. When done safely and properly, a vampire facial should not expose clients to any such bloodborne infections and is prompt and to rejuvenate the face so that the skin looks younger, experts say. So if you're young adults getting HIV test, here's why. Okay. So yet, if the microneedling pen or any other equipment is not properly disposed of or sterilized between the facials, that could expose patients to potential bloodborne infections, as seen in New Mexico. Dr. Ahsan Ali, a board certified internal medicine physician, known as the Beverly Hills concierge doctor, said last year. So Ali was not involved in the New Mexico cases, but infections could occur if microneedling tips or syringes were reused, or if another patient's blood was used to perform the facial, for instance. And so Ali advised patients interested in vampire facials to make sure that they see practitioners opening new syringes to draw blood. And so, as well as changing microneedling pins before performing this procedure. So, just make sure that you're seeing everything being done in front of you, he said, and make sure that the place is using new equipment, changing the tips and the needles. And New Mexico's Department of Health noted on Monday that anyone desiring cosmetic services involving needle injection should verify that services are being provided by a licensed medical provider. So, there you have it, and that is having to do with the vampire facials. And so there is a video, however, there is a video accompanying with it. I don't know if there's a commercial in the beginning. Some videos have commercials, some don't. We'll try and see if it plays.
Your screen doesn't need repairing, but your weakened enamel might.
Try gum and enamel repair from Crest.
The World Health Organization estimates 35 million people worldwide are living with HIV. About 1.2 million are in the United States, where an estimated 50,000 people each year become infected. Scientists first identified HIV, the virus that causes AIDS, in 1983. It is believed the virus originated in chimpanzees in West Africa. Humans came in contact with their blood and became infected. Now, this is a picture of what the virus looks like under a microscope. Once infected with it, symptoms can include fever, headache, sore throat, rash, swollen lymph nodes. But in some people, HIV symptoms don't appear for years. The U.S. estimates 1 in 8 people that are infected with HIV don't even know it. So for 3 decades since HIV was first identified, does being HIV positive mean a death sentence? The answer is no. These days, people infected with HIV can have a normal life expectancy. That is, if the infection is caught early and if they are treated properly with drugs known as antiretroviral therapy. The cocktail can be so effective that after a while, the virus can become virtually undetectable in tests. But once you are infected with HIV, you have it for life. So far, there is no cure.
So we're going to move on from that. There is a new drug out, and I am going to read about it that is related to this virus. And I'm trying to pull up the article right now, and I will switch over to the article. So the new article, or the new articles that have been printed out about HIV treatment. This is out of Health News, News Britain's most trusted digital news brand. HIV treatment breakthrough as drugs stop the transmission of the virus after unprotected sex. So, 8-year study of nearly 1,000 gay couples, where one partner has the HIV and is positive, found no reports of HIV transmission. So, clicking off on something. So, this is by Paul Gallagher. And this was not very long ago, about 19 hours ago. So, it is a very fairly recent article that has come out. And there are many others that follow it or that are similar. So, effective HIV treatment means the virus is not sexually transmitted between gay men during unprotected sex, where one partner is HIV positive, according to the research. So, a European study of nearly 1,000 gay male couples who had sex without using condoms, where one partner was HIV positive and on suppressive antiretroviral therapy, which is abbreviated as ART, and the other, HIV negative, reports no cases of within couple HIV transmission for over 8 years. So during that time frame, 15 HIV negative men became infected with HIV, but none of the viruses screened in the newly infected partner was genetically linked to the HIV virus that had infected their main partners, ruling out any within couple HIV transmissions. The research team said so nearly 500 transmissions prevented. So, importantly, the researchers estimated that effective antiretroviral treatment or transmission, that is, what does it say? I'm looking at it because I got a therapy. So it's what is it, art? So it's called retroviral therapy. That's what it's called. Okay, so importantly, the researchers estimate that effective art prevented around 472 HIV transmissions during the course of the study. So the authors of the study, the largest of its kind and published in the Lancet, stressed the importance of regular monitoring and supporting people with long-term adherence to the therapy. So our findings provide conclusive evidence for gay men that the risk of HIV transmission with suppressive art, which are these drugs, and I keep going back to it, which it's called antiretroviral therapy, which is very good, I guess, at suppressing that virus to zero. So, a professor, Alison Roger, from University College London, who co-led the research. You see here, over 8 years, the drug stopped the transmission of the virus for all couples. And so that's not only gay couples, that's also heterosexual couples as well. So, promising medical treatments. So, in March, a London hospital patient became the second person in the world to be cured of HIV after experimental treatment, doctors said. So, the unidentified man named the London patient has been free of the virus for 18 months and has not had to use treatment to make his HIV undetectable. So, after a stem cell transplant was used to treat his cancer, so he is clearly in long term remission from that virus. So the male patient has achieved sustained remission from HIV after being treated at Hammersmith Hospital in West London, Imperial College Healthcare, NHS Trust said. So the patient has received bone marrow stem cells for the past 3 years from a donor who carries a repressed version of the CCR5 gene. So CCR5 gene provides a pathway for the HIV virus to harm a person's immune system and become infected with the virus. So the Berlin patient, the first patient to be cured of HIV, underwent experimental treatment in 2007. So when he was given a bone marrow transplant to treat his leukemia, he was matched with a donor with the CCR5 mutation, which block HIV attaching to the cells. So the Berlin patient later identified as Timothy Ray Brown, 52 years of age, now lives in Palm Springs, California, and he's still HIV free. So that is pretty much how they are coming up with a breakthrough and also new medication to try to curtail or stop the transmission. So HIV treatment breakthrough as drugs stop transmission of virus. So you can still get it. And from what they've been working on, they've been trying to work on these particular patients and monitor them, monitor, that the drugs are working well. And so they're still working on it. And that is relatively really good news. So I'm going to go back up on that one. So what do you think about that? But I will say this, money is an issue, healthcare is an issue, and the stigma around it is an issue. That's what I've read. Some people don't want to go get tested. They don't know how to access medical treatment, or they don't have insurance, or they're afraid that they need to tell where they're from, and they may not be a legal resident of the US. There could be many factors here at play. There could also be giving this treatment. How much is this treatment going to cost? Is it going to be readily accessible for those who are on the low income scale? And so I read somewhere where it said those issues still play a huge part as to why the HIV infection may not be totally dismissed, even though they have found some credible treatments and drugs. And it has to do with who has access to the drugs and who's going to be allowed and afforded the access to the drugs. So that's the big issue. And so, with that being said, let me see here. AIDS breakthrough as study finds the drug stop HIV. Breakthrough HIV vaccine set to start human trials in 2019. So they're in the trial stage and they're trying to test people to see how long they go without being detectable as being HIV positive. And so there's been many media outlets that have been reporting on this. So these are definitely credible breakthroughs, but we still have other other things that could get in the way. So even there's something down here saying, could a transplant breakthrough help people with HIV? So there's a lot, and I'm going to add a little more in here too. There's also people who feel that there are people who already knew things that could help cure people of these diseases, but they weren't given an opportunity to use their methods because of the fact that big pharma or pharmaceutical companies make money off of people being ill. And so that is the reason why there's a lot of talk about um, whether or not these these breakthroughs, even though they're there, are they going to be accessible to people on low income or in neighborhoods where they don't have a lot of exposure to, the breakthrough treatments for these type of illnesses. So that should come into play. So could a transplant breakthrough help people with HIV? So there's a lot of different things that are coming up here. Talk to our live doctors about this, breakthrough.com. So if you're HIV positive or if you have AIDS, then why not try this alternative medicine? So there's a lot of different people that are proclaiming too. So be aware. There's a lot of different people proclaiming that they have different cures to different things. But if it isn't something legitimate, then you might want to wait and you might want to get clarification on it before you take something that might make your situation worse. So a lot of people are really, really wanting these things to be, official, but they're still, as far as I'm concerned, I believe they're onto something. But two, I believe there's a possibility that the cure was always there. It's just that getting access to things, or getting, legal credibility that you can cure, or you have certain ingredients that will cure certain way a person eats, what they eat, what they drink, how their lifestyles changed, whether that works. So there's a lot to be said about this. So what do you think about this? What are your thoughts? I've heard people say that Dr. Sebi, he had the cure. So what are your thoughts and feedback on this? Do you think this is legitimate or not? Like, comment, subscribe, and thanks for listening.